I never know when I'm going to lose my RV. I could be in a tent tomorrow because I can't afford any other type of housing. So day by day, you never know what's going to happen or where you're going to be tomorrow. If you're going to be safe, if you're going to be sheltered, it's scary.
I became homeless. I got kicked out of my home. I ended up sleeping on park benches at first because it was sort of May. And then after that, I just kept sleeping on benches and I finally got a tent. I got a tent and then the police came and took my tent down and told me I had to leave. They destroyed my tent.
Homeless in America is not just a statistic. It's a crisis affecting thousands, even in Oklahoma, a state not typically associated with poverty or social issues. So why is the homeless population rising in a place many consider the heart of America? And more importantly, what is being done to address this? These are questions that can't be ignored any longer. With the situation only worsening, can Oklahoma find a solution to this growing crisis before it becomes irreversible? One, the growing reality of homelessness in Oklahoma. Homelessness in Oklahoma is not just a statistic, it's a growing crisis. As of January 2025, Oklahoma City recorded 1,882 homeless individuals, while Tulsa, the state's second largest city, followed closely behind with 449 people experiencing homelessness. These figures are alarming, but they don't tell the whole story. Behind each number is a person with a unique journey. A mother trying to protect her children, a veteran who once served his country now battling to survive on the streets, or an elderly man, once a hardworking member of society, now left vulnerable in an unforgiving world.
No, I get $1,200 a month and you can't buy food and live in an apartment on $1,200 a month. No, you can't.
In Oklahoma City alone, 63% of the homeless population is staying in shelters. 13% are in transitional housing. But the most disturbing statistic is the 22% who are unsheltered, sleeping on park benches, under bridges, or in doorways, exposed to the elements. These individuals are the most at risk, often overlooked and invisible to the public eye. Why is this happening? The reasons are not simply a result of a housing shortage or economic downturn, though those factors certainly contribute. The rising rates of homelessness in Oklahoma are a reflection of a broken system, a system that fails to address the root causes. It's not just about losing a home. It's about the lack of affordable housing, inadequate mental health services, and the failure of support systems that should be helping those who need it most. This is not just an issue in Oklahoma, it's part of the larger crisis of homelessness in America. Programs and initiatives have been put in place, but are they enough to stem the tide? The current efforts often feel like quick fixes, unable to solve the deeper issues that cause homelessness. As the numbers continue to rise, it begs the question, can we turn this crisis around before it's too late? The problem is growing, and it's time for lasting solutions that address the root causes, not just the symptom. Two, the economic forces driving homelessness. One of the major factors contributing to homelessness in Oklahoma is the growing economic pressure. Between 2020 and 2025, rental prices in Oklahoma soared by over 20%, while wages for most workers remained stagnant. This widening gap between income and housing costs has made it increasingly difficult, if not impossible, for many families and individuals to secure a stable place to live. Like many other states across the nation, Oklahoma is grappling with a severe shortage of affordable housing. developers, driven by the rising demand for more expensive housing options, have not been building enough affordable units to meet the needs of lower-income families. The cost of living continues to rise, yet wages aren't keeping pace. This imbalance forces many people, especially those in low-wage jobs, to choose between paying rent or covering basic necessities like food and health care. For many Oklahomans, this means being forced out of their homes, either because they can no longer afford to stay or because their housing is deemed unfit to live in. This is the harsh reality for thousands of individuals who find themselves at risk of homelessness, unable to secure a home that is both affordable and stable. However, it's not just the price of housing that is driving people to the streets. The issue is more complex. Mental health problems, addiction, and a lack of job opportunities are all contributing factors. The system that is supposed to provide support, whether it's through social services, affordable health care, or access to job training, often falls short, leaving people with nowhere to turn. The rising cost of housing is undeniably a major driver, but it's the failure of the broader system to address the underlying causes of homelessness that has allowed this crisis to grow. As the cost of living increases and wages remain stagnant, more people are falling through the cracks. The question remains, why isn't the system doing more to help those in need? As we explore the root causes of homelessness, it's clear that the problem goes beyond just the price of rent. It's about creating a system that can truly support those at the bottom, giving them the tools they need to escape poverty and regain stability. But with the current trajectory, it seems that without major changes, more Oklahomans and Americans will continue to find themselves without a home. Three, social and health issues amplifying the crisis. While the economic factors driving homelessness in Oklahoma are significant, they are far from the whole story. Many of the individuals facing homelessness in the state are also grappling with complex mental health and addiction issues that make their situation even more dire. In cities like Tulsa, a significant portion of the homeless population, around 28%, are struggling with mental health problems, with addiction playing a major role in exacerbating their plight. The state's mental health system is severely underfunded, leaving too many without the help they desperately need. There simply aren't enough resources to go around, and those who require mental health services or addiction treatment often find themselves on long waiting lists or without any support at all. For many, this lack of access to proper care becomes a cycle that's nearly impossible to break. Shelters, which are already overwhelmed by the rising number of homeless individuals, are often the only option for those in need. However, shelters aren't equipped to deal with the complexities of mental illness or addiction. Without specialized care, individuals with these challenges are stuck in a revolving door, entering shelters, only to leave when they're unable to get the care they need, often ending up back on the streets. The harsh reality is that without access to mental health services and addiction treatment, many individuals are left with few choices. The streets become their only refuge, but without the necessary support, these people are unable to rebuild their lives or regain their independence. So, what's the solution? The answer isn't easy. It's not simply about building more shelters or providing temporary housing. We need to address the root causes of homelessness, specifically the mental health and addiction issues that contribute to it. Without proper treatment, those struggling with these issues will continue to fall deeper into homelessness, unable to escape the cycle that keeps them trapped. To truly tackle homelessness in Oklahoma, it's essential that we invest more in mental health services, addiction treatment, and long-term recovery programs. Until we provide these individuals with the care they need, we will continue to see homelessness as a lifelong struggle for many. It's time to stop viewing homelessness as a crisis of the homeless and start seeing it as a failure of the system that's meant to support them. 4, why are people falling through the cracks? With such a high number of homeless individuals, it's only natural to wonder, why aren't existing programs doing more to help? Across Oklahoma, many organizations are working tirelessly to provide services. Yet, the truth is that demand far exceeds the available resources. Despite their efforts, countless people continue to fall through the cracks. Initiatives like Oklahoma City's Key to Home program, which partners with over 50 organizations to offer housing, job support, and mental health services, have helped some individuals find stability. However, these programs are often limited in scope and cannot keep up with the ever-growing need. In fact, Oklahoma, like many parts of the country, is only scratching the surface of what needs to be done. Even the most successful programs struggle to expand quickly enough to meet the increasing number of people experiencing homelessness. The reality is that the resources currently in place are insufficient. Shelters are overcrowded, and wait lists for essential services like mental health care and addiction treatment are often months long. Homelessness is a complex issue that doesn't have a one-size-fits-all solution. Many individuals facing homelessness also struggle with overlapping challenges, such as mental health issues, addiction, and financial instability. These intertwined problems require more than just temporary solutions. They need comprehensive, long-term care that goes beyond providing a bed for the night. The issue isn't just local, it's part of the broader crisis of homelessness in America, a problem that has reached alarming levels across the country. While programs like Key to Home have had some success, they aren't enough to tackle the root causes of homelessness. Without substantial investments in expanding these services and addressing the systemic issues that lead to homelessness, Oklahoma's efforts will remain inadequate. The question is, can the state find the resources to confront this issue head-on, or will the cycle of homelessness persist, leaving more people trapped without a way out? Government-led initiatives and their limitations. Oklahoma's government has made strides in addressing the growing homelessness crisis, but many argue that the current efforts remain insufficient to cope with the increasing demand. One key initiative is Oklahoma City's Key to Home program, which brings together over 50 community organizations to provide not just housing, but also critical mental health services, addiction treatment, and job training. This initiative aims to offer a comprehensive solution to help people transition from homelessness to sustainable living. However, despite some successes, the program faces significant limitations in scaling up to meet the rising numbers of individuals in need. The Encampment Rehousing Initiative is another government-backed effort designed to relocate individuals from unsafe, unsanitary encampments to more stable housing. Though more than 350 people have been successfully relocated through this initiative, it's clear that such efforts are insufficient in the face of overwhelming demand. The shortage of affordable housing and ongoing funding challenges are major obstacles that prevent these programs from effectively addressing the issue on a large scale. Additionally, the waiting list for affordable housing can stretch up to 2 years, leaving individuals stuck in temporary, precarious living situations. While these efforts are commendable, the reality is that they are only scratching the surface of a much larger issue. Until there is more investment and a broader, coordinated strategy, these programs will continue to provide temporary relief, but will not solve the systemic causes of homelessness. Six, community-led solutions and their struggles. In addition to government efforts, various community organizations in Oklahoma have been stepping up to tackle homelessness, yet their initiatives often fall short of making a significant impact. One of the central programs is the Key to Home program, which partners with over 50 organizations to provide housing, mental health services, addiction treatment, and job training. While it has had some success, its reach is limited by the persistent shortage of affordable housing and insufficient funding. The program is unable to expand quickly enough to meet the growing demand, leaving many people without the long-term support they need. Similarly, the Encampment Rehousing Initiative, launched in 2023, has provided an opportunity for 350 plus individuals to transition from makeshift camps to more stable housing. This program highlights the critical need to break up dangerous encampments, but it also exposes the limitations of temporary housing solutions. With no permanent housing options in place, those relocated from encampments often find themselves in the same cycle of instability. Both of these community-driven efforts show promise, but they need broader support and expanded resources to effectively address the root causes of homelessness. Without greater funding, better coordination, and more long-term housing solutions, these initiatives will continue to fall short. Seven, my personal perspective, a call for change. Homelessness in Oklahoma and across America has reached a point where temporary fixes are no longer enough. Programs like Key to Home and the Encampment Rehousing Initiative have seen some success, but these victories feel small in the grand scheme of a crisis that's far from being solved. To make real progress, we need to rethink our approach to homelessness. It's not just about housing, it's about a complex web of social, economic, and mental health challenges that demand a comprehensive, multifaceted solution. One critical shift is moving towards prevention. Currently, most programs focus on the aftermath of homelessness, providing shelter and support for those already on the streets. While this is essential, what if we could stop people from falling into homelessness in the first place? Early intervention, expanded mental health services, and support for families at risk could make a huge difference. Additionally, there must be a statewide push to invest in affordable housing. Oklahoma, like many other states, is facing a severe shortage of housing that meets the needs of its most vulnerable residents. We need to build more affordable housing and offer rent assistance for those struggling to make ends meet. But it can't be just the government's responsibility. Ending homelessness requires a community-driven effort. Local businesses, neighbors, and citizens all have a role to play. Until we address the root causes, economic inequality, mental health, and addiction, Oklahoma's crisis will continue to grow. It's time for a broader conversation that goes beyond surface-level solutions. Eight, moving forward, what needs to change. The fight against homelessness in Oklahoma requires a fundamental shift from short-term relief to long-term sustainable solutions. While the current efforts provide temporary help, they fall short of addressing the root causes of homelessness, which are far more complex than just a lack of housing. To truly tackle this crisis, comprehensive strategies must be developed. Strategies that not only focus on increasing the availability of affordable housing, but also address the underlying issues such as mental health, addiction, and financial instability. First and foremost, funding must be increased for both temporary shelters and affordable housing initiatives. The current systems are underfunded, and they cannot keep pace with the growing demand. Shelters and housing programs are overcrowded, and the wait lists for affordable housing are far too long. For instance, in Oklahoma City, the wait list for affordable housing can extend up to 2 years, leaving many individuals and families in limbo. To make a significant impact, Oklahoma needs to allocate more resources to increase the availability of housing options and ensure that they are accessible to those who need them the most. In addition to housing, mental health services and addiction treatment are essential to addressing homelessness effectively. Many individuals experiencing homelessness face mental health challenges, addiction, or both. However, the support available to them is often insufficient or fragmented. Investing in these services and integrating them into housing programs is crucial. It's not enough to offer someone a bed for the night. They need access to the care that will help them rebuild their lives. Without comprehensive mental health and addiction services, many individuals will continue to cycle in and out of homelessness, unable to break free from their struggles. Even more critical than intervention is prevention. Oklahoma must prioritize early intervention to prevent people from becoming homeless in the first place. This could include better access to health care, more affordable housing options, and stronger community support systems. By intervening early, we can stop people from falling through the cracks and help them stay afloat before they lose everything. Prevention is not only more humane, but also more cost-effective in the long run. To address homelessness in Oklahoma, and by extension, the broader issue of homelessness in America, requires a coordinated, all-hands-on-deck approach. Local governments, nonprofits, and the private sector must work together, combining their resources and expertise. Homelessness is a collective problem that requires collective action. It's time to take a unified, long-term approach to this crisis, to change the future of homelessness and to ensure that no one is left behind. This is not just an Oklahoma issue. It's a national crisis that demands our immediate attention and action. Conclusion. Homelessness in Oklahoma is a crisis that demands immediate action. The current solutions are not enough. Temporary fixes only prolong the problem. To make lasting change, Oklahoma must invest in affordable housing, mental health services, and preventative measures. The longer we wait, the more lives are affected. It's time to move beyond the surface and address the root causes of homelessness with comprehensive, long-term solutions. Will we continue to ignore this growing issue, or will we rise to the challenge and create real change? The choice is ours, and it's time to act.